Can I say this? It's great to see so many people here today for this inaugural event of the Parliamentary Friends of Parkinson's Disease, and I welcome you all to the oldest parliament in Australia. My name is Phil Donato. I'm the member for Orange, the independent member for Orange, and along with my parliamentary colleagues, Mr. Robert Dwyer, MP, the Liberal member for Port Macquarie, and got the Port Macquarie fan club here, and also Joe McGurr, Dr. Joe McGurr down the back, independent MP, member for Wagga Wagga. We are the three co-chairs of the Parliamentary Friends of Parkinson's Disease. And it's great that we're also joined by many other of our parliamentary colleagues from across the political spectrum. This is an issue that spreads wide and far, much further than politics. So I know we've got Stephen Barley here. I did see Dr. Michael Holland as well, who's the Parliamentary Secretary for Health. Justin Clancy, the member for Albury. I know I'm going to miss somebody, but anyone else at the moment? I'm sure there'll be members coming in and out. We are going to hear from Rose Jackson, the Minister, during the course of this next 30 or 40 minutes. Greg Ryan, the MP for member for Campbelltown. Welcome. Thank you, Greg. So that just goes to show you, it's a busy sitting day, but it just goes to show you the support that you have right across the Parliament. There's about 30 odd members of the Parliamentary Friends group that we have already. So although not all of them are here right now, there is a lot of support in this building for Parkinson's disease. I'd also like to especially welcome the Honourable John Watkins, AM, former Deputy Premier of New South Wales. Welcome back to the Parliament, John. It's great to see you. Not much has changed, I wouldn't have thought, but great to see you back. I also wish to welcome many other people who unfortunately weren't able to make it today, but who are joining us online via the live stream. And welcome to all those. Seats were limited, and such was the popularity of this event. There were many people who weren't able to, unfortunately or fortunately, not able to attend. So welcome to those. I know many have come long distances. Many of you have come from right across the state to make today, and that's adds a very significant tone to how important this issue is to all of us here today. But I also want to especially acknowledge a couple from Orange, from my electorate, Bernie and Peter Duffy as well. So thank you for coming down for this event as well. I also want to welcome Mary Kay Walker, CEO of Parkinson's New South Wales. Everyone knows Mary Kay, I think, there she is, Mary Kay. And Professor Carolyn Sue, Chair of the National Parkinson's Alliance as well. I acknowledge today, give her a clap. I acknowledge today we're meeting on the Gadigal land, and I pay my respects to elders past and present. In New South Wales alone, there are close to 70,000 people living with Parkinson's disease. The disease is indiscriminate, it's debilitating, and presently there is no known cure. And for every person living with Parkinson's disease in this state, there are over 206,000 family members, friends, carers, and communities also impacted living with Parkinson's each day. For everyone who suffers from Parkinson's, however, has a unique journey. And today it's a reminder of those stories, the strengths and the resilience of all of you. But there is also so much positive happening in this space and much hope. And today's event is about connection, education and empowerment. Over the next 30 or 40 minutes, you will hear from those working in the sector about the medical research and advocacy currently being undertaken, along with those with lived experience. You'll also hear from some remarkable Parkinson's nurses who do an amazing job, but sadly we need more of. We hope that you leave informed, connected, and reminded that you are not on this journey alone. As members of Parliament, we are here to listen, help, and do what we can to raise awareness, advocacy, and support for all those people living with Parkinson's in our community. I will now hand over to our MC for today, CEO of Parkinson's New South Wales, Mary Kay Walker. Mary Kay is someone I know is an extremely passionate advocate who leaves no stone unturned, no door closed, and she is a fierce and relentless advocate on behalf of people living with Parkinson's in New South Wales. Mary Kay. Thank you. thank you for being here today and for emceeing and for the work that you've been doing. I know when Mary Kay first came and saw me a couple of years ago, we had a meeting in this building and she was doing the rounds, knocking on all the MPs' doors, as is her job, right? And we had a great discussion there, and we've formed a great friendship. So, Mary Kay, thank you for all the work that you do. I know it's certainly appreciated, and thank you for you and your team, the support that you provide to so many people and families right across New South Wales. I'll hand over to you, Mary Kay. Thanks.
Appreciate it, Phil, and I'm very proud to be standing up in front of you today. And we're just so thrilled that a number of the MPs have gotten together to create the Parliamentary Friends of Parkinson's. So my role today is to MC and make sure everything keeps to time. The next person I'd like to introduce to you is Robert Dwyer, the member for Port Macquarie, and it's his duty to introduce the nurses today who are going to speak to you and share their stories with you on the ground. So, Robert.
Thank you, Mary Kay. It's my absolute honour and privilege to be up here today to present to our Friends of Parkinson's. And whilst I've only been in this role for not quite 12 months, I don't recall seeing a meeting that's had as many people attend at our first inaugural Friends of Parliamentary meeting. So well done to everybody. And I can't thank you all, the most important people here, which is everyone in the room today, for your attendance. I also have the pleasure of knowing that we've got a fan club here that's come down from Port Macquarie, so I thank you very much for that. We have our president, Kim, with her husband David, Carol Rudolph Zabrowski, Teresa Goshen, Rob Wilson, and Jodie Lloyd. So thank you very much for making the big journey down from Port Macquarie. Great to have you here. I have the pleasure of introducing Jo Lavelle. Jo is a clinical nurse consultant from Tamworth, and she's born and raised in Orange. Jo's a proud country nurse with a deep connection to rural and regional healthcare. She completed a Bachelor of Nursing at the University of Newcastle and began a career in coronary care and high dependency in Maitland Hospital. After spending 12 months working in Sydney, Jo relocated to Mudgee, what a great place, where she's lived and worked for 14 years. During her time in Mudgee, she has worked as a practice nurse in general practice and obtained a postgraduate qualification in diabetes education, further strengthening her chronic disease management expertise. And in 2018, Jo moved to Tamworth with her husband, a paramedic with Westpac Rescue Helicopter Service, nothing like keeping her in the family, and their 2 sons. Jo led the PHN-funded pilot program for movement disorder nurse and is now the Parkinson's clinical nurse consultant for the New England and West region. She is about to commence her second and final year of a Masters of Nurse Practitioner, specialising in Parkinson's disease. How fortunate are we to have you here today. Please, Jo, come up and we'd love to hear your story.
Good afternoon, everybody. Thank you for the invite to be here this afternoon and to speak to you all. So just to introduce myself again. So I work in the New England Northwest, and that area is about 80,000 square kilometres, which is equivalent to about the size of Austria, and there's just me. So it's a large area. So the most recent statistic that we have was 2018, and there was 696 people living with Parkinson's in that area. Now, obviously, with it being the fastest growing neurodegenerative condition in the world, with 50 odd people diagnosed each day, there's obviously a lot more people now living with Parkinson's in the New England Northwest. So I thought the best way to possibly just explain my role is to give you a case study, for want of a better phrase. Mr. L. Doper here it's a very convenient name. So this gentleman is a 78-year-old broadacre crop farmer that lives in an MM6 area, so very remote. So 3.5 hours from Tamworth. So in the New England, we have some neurologists based in Tamworth, and then we have the regional specialists that have neurologists that will fly in and fly out. So he goes the other way and goes 5 hours to Brisbane to see his neurologist. His GP is 40 minutes away in a larger centre, of which it's very difficult for him to get an appointment to. He's had a diagnosis of Parkinson's for 6 years, and I became familiar with this gentleman thanks to a local community nurse who was actually caring for his wife. And I guess that just goes to show how referrals can come from anywhere. So I'd organised a face-to-face visit to go up and see him. So when I do an initial assessment, it would be the motor and the non-motor symptoms. We do tend to concentrate a lot on the motor, but the non-motors can be as important and affect people's quality of life just as much. Carer wellbeing is really important too. Parkinson's, as we know, it involves everybody. Their friends, their family, and their carer can sometimes. No carer has ever put themselves first, so we need to be aware of that. I've found that the need for social prescribing, particularly in a post-COVID world, has been really important. So I always ask, like, what do you enjoy doing? So some people, I really did enjoy knitting. Now I can no longer knit. Okay, so what else can we do? What do you feel like you're capable of doing? I think it's really important for us to ask how they enjoy living their lives. The My Aged Care NDIS and local community groups help people navigate around those. And then digital literacy. This gentleman had satellite internet, but there's a lot of people that live in regional remote areas that don't have reliable internet access, so we've got to try and come up with solutions for that as well. So just quickly, just some of the things that that we identified through the consult that I did with this gentleman. He had a very little understanding of Parkinson's at all. He'd had the diagnosis for 6 years and he had very little understanding of what Parkinson's was. So without the intervention of a Parkinson's nurse, it can lead to increased difficulty with the management and possibly an unnecessary worsening of symptoms. So with Parkinson's nurse intervention, education's obviously the key, which then leads to self-management strategies. And so that's what happened with Mr. L-Dopa. He got a better understanding, so then he knew what was happening, why it was happening, and if possible, how he could prevent it. Medications, Parkinson's medications. So they were in a plastic container mixed with his wife's medications. And so we went through and, no, that one's mine. Oh, that might be mine, I'm not sure. So obviously there's a risk of confusion with the medications, but also in regards to Parkinson's, the importance of the dose timings. And again, that comes with education because he was unaware of why it was important to be on time with medications. So if someone's randomly taking their medications, then they're obviously not working per se, and so there's reduced adherence to a schedule. Again, with the intervention of a Parkinson's nurse, we can explain why timing's important, the purpose, and adjust schedules to fit within that person. This week marks 27 years that I've been a registered nurse, and I've never found something as diverse and individual as Parkinson's. Everybody is different. Everybody that's living with Parkinson's in this room would be absolutely individual in their management, what's important to them, how medications are working for them. So it's important to remember that. So for this gentleman, he would work isolated a lot of the time on his farm. So we came up with the solution that a Webster pack that he just takes with him with an alarm was going to be the best. People don't realise things like swallowing issues can sometimes be Parkinson's related. So we had a discussion around the risks with that, which he was unaware of. So obviously, again, without the Parkinson's nurse intervention, there's the risk of hospitalisation, decreased nutritional status. People are avoiding things to eat, and so that's without the Parkinson's nurse. With the intervention, they have the education around the risks, and we can get allied health to intervene there. So we referred him to speech pathology and the dietitian. Increased falls, which is a big one. Obviously, injuries from falls and hospitalisations. We all know about fractured neck of femurs and the increase in mortality with that. So advice on risk reduction. The amount of bathrooms I've walked in and it is carpeted with foot mats. So being able to discuss risk reduction as well. And then obviously the involvement of allied health through exercise physiology or physiotherapy. And we referred him for an occupational therapy review of the home environment. But we encouraged the removal of the mats first. So carer strain. Carer strain is a really big one. Carers, as I said, they never put themselves first. I didn't want to complain because I've got nothing to complain about, but carers are really important. If something happens to our carers, well then something is, the situations can become quite dire. So we need to make sure that we identify feelings of isolation and issues, mental health issues. So the wife of this gentleman, it's getting louder. I was trying to move past the first beep, but I'm not sure I can move past the second. I'm waiting for the third to kick in now. It is like that, isn't it? What we were able to do for Mrs. L-Dopa was refer her to Carers Gateway, so she was aware of carers support around, and we found some activity groups that were positive for her that she was able to join. Future planning is a big one. In this case, as I said, large farm. Family, the children did not want to take over this farm, so they needed to look at how they were going to be downsizing. It's a continual problem that things get to a crisis point before anything is done. So I make sure when I see somebody that I ensure that they're registered either with My Aged Care or the NDIS, and if they're not, explain to them what it is and to help them navigate around that. So we registered both Mr. L-Dopa and Mrs. L-Dopa with My Aged Care, and then for future planning for me, I ran through a Teams meeting and how we could do a Teams meeting over the next 12 months so we could see how happy he is after Parkinson's nurse intervention. He's so happy after I came to see him. So, so we had some regular telehealth catch-ups and planned a face-to-face review. I made sure that, like everywhere, but it's particularly of note in rural areas, the wait times for allied health. So over the subsequent months, I made sure that the referrals that we'd made had been put into place, which they had. And then it's a team effort. from a Parkinson's nurse point of view. So communication with their GP and treating neurologist afterwards, so they know I'm involved. And if there was anything specific, then we can discuss that too. But we need to wrap that team around the individual and hopefully make living with Parkinson's slightly easier. Thank you.
We should have perhaps mentioned it at the start that one of the vagaries of being in Parliament House, that when there's a division, the bells go. So what we've had is a division in both houses, and unfortunately the politicians have had to leave, but they will be coming back once they've gone in and voted and done what they've needed to do. So unfortunately Robert has needed to leave, but we do have the Deputy Liberal leader, Natalie Ward, who's going to introduce Rachel McKinnon.
Thank you, Mary, and welcome everybody. I'm not Rob Dwyer. He's much more impressive. My name's Natalie Ward. I'm stepping in for Rob, who is doing his duty voting in the chamber right now, and I apologise for the bells. We just get used to them, so just ignore them, keep talking, and relax and enjoy. But it's my great privilege to stand in his shoes and represent him as one of the co-chairs at this launch of Parliamentary Friends of Parkinson's, and thank you. It's wonderful to see such a great turnout today, and can I acknowledge colleagues in the room too, of course. And thank you to the organisers. Thank you, Mary, and thank you, Joe, for that great case study. My privilege is to introduce Rachel McKinnon, who's going to be presenting. Where are you, Rachel? Right here in the front, ready to go. Rachel is presenting a case study today, and she's a clinical nurse consultant in movement disorders at Neura, with over 20 years' experience in neurology and neuroscience nursing across metropolitan and regional New South Wales. Rachel grew up in a very rural town, Walker, New South Wales, where her father was the local GP. And I think that says an enormous amount for the amount of experience and real-world understanding you have. And was a strong advocate for his patients, and shaped your commitment, obviously, Rachel, to patient-centred care. Rachel has led specialist Parkinson's services, pioneered telehealth, that great thing that if one good thing came out of COVID, it was telehealth, and rural outreach clinics, and contributes to major research studies. She's a passionate advocate for equitable, high quality care for people living with Parkinson's, regardless of where they live. And I think that's one of the fantastic things that we have with this service. So thank you all for being here, and please join me in welcoming Rachel.
Oh, lucky me, it stopped. I was wondering how I was going to do that, Joe. That was amazing. Thank you, Parliamentary Friends of Parkinson's, colleagues, friends and my family, thank you. It's a great honour to be here today. I want to begin not with statistics, but with a person. Several years ago, I was assisting a neurologist at St Vincent's Hospital with the assessment of a 68-year-old man who'd been transferred up from Wagga Wagga. We were about to perform a routine neurological examination in Parkinson's disease. You know, the finger tapping, the stiffness, and that slightly confronting test that we do where we like to pull people backwards to assess their balance. It's a kind of assessment that helps us quantify Parkinson's disease. From the outset, I could tell that this gentleman had fairly advanced Parkinson's. He was bedbound, his voice was barely audible, and his face was masked. And the trajectory being discussed in nursing handover was residential aged care. As we began the assessment, I realised he was lying in a wet bed, not because he was incontinent, but because he was profoundly medication off. He was so immobile that he couldn't summon help in time. Parkinson's had also affected his bladder. He'd likely needed that toilet 5 minutes earlier. And 5 minutes in Parkinson's can be the difference between dignity and humiliation. The doctor and I paused the examination so I could help him change his bedding and his clothing. When I opened up the locker, his bedside locker, I found 4 perfectly ironed sets of pyjamas, singlets and underpants, folded with care and quiet devotion. In that split second, I knew this man was not just my patient. Someone had loved him enough to prepare his clothing with dignity, order and pride, knowing that Parkinson's would not afford him the chance to do that himself. Before I ever met her, I met his wife in the way she loved him. Her love was right there in that locker, in the effort, the care and the dignity she was still trying to protect for him, even as Parkinson's threatened to strip it away. Parkinson's disease is a movement disorder, tremor, stiffness and slowness. But what rarely appears in policy documents are the invisible consequences: the bladder that won't wait, the voice that can't call for help, medications that wear off unpredictably, and the fear of falling, freezing, choking or simply becoming a burden. Parkinson's is insidious. It progresses slowly and relentlessly. And while I deeply value and admire the investment in Parkinson's research, the reality is that we still don't have a cure or proven disease-modifying therapies. So what can we do? We can care better. And it's that where specialised Parkinson's nurses make an extraordinary difference, as shown by Jo. Parkinson's nurses are not just generic nurses who see people with Parkinson's. We are highly specialised clinicians who understand complex medication regimes that change hour by hour. We understand motor fluctuations and non-motor fluctuations. We can prevent avoidable hospital admissions, and we can support carers at breaking point and coordinate care across neurology, aged care, primary care and allied health, while constantly and consistently advocating for and protecting our patients. And believe me, we do a lot of protecting for our patients. As specialised Parkinson's nurses, we have the honour and privilege also of developing deep and consistent and professional relationships with people living with Parkinson's and those who care for them. These relationships are built over years through difficult conversations, medication failures and successes, moments of crises and moments of quiet adjustment. Parkinson's is a long, progressive and unpredictable disease, so continuity matters. We often become the one clinician who knows not just the disease, but the person, what frightens them, what matters to them, and what allows them to keep living with dignity. We translate special advice into real life. How do I take this medication if I can't swallow? Why am I hallucinating? Why do I freeze in the doorway but move freely in the kitchen? How do I stay at home longer? Because Parkinson's care doesn't happen only in clinics, it happens at 2 a.m. when someone is stuck, frightened and unable to move. It happens when a carer is exhausted and quietly grieving the changes in the person they love. And it happens in the practical details, exactly where specialist nurses can change outcomes. In this man's case, with specialist input and access to appropriate Parkinson's therapy, his admission into the residential aged care was delayed. Instead of entering a nursing home, he and his wife returned home. I will never forget them walking out of the ward that day, swinging their arms and holding hands. In the months that followed, they told me that they had travelled around Eastern Australia, something they thought that was no longer possible. And when his brother-in-law died, his family watched in disbelief as he stood and served as a pallbearer, reclaiming a role Parkinson had tried to take from him. These are not soft outcomes. These are life outcomes. Parkinson's disease is the fastest growing neurological condition in Australia, yet access to specialist Parkinson's nurses in New South Wales remains uneven, postcode dependent and largely absent in rural areas. The word catchment scares me. Of course, we can cost the measurable outcomes. We know that there's fewer ED department presentations, shorter hospital stays, delayed entry into residential aged care and reduced carer burden. But I want to ask something more fundamental. How do we measure the restoration of dignity when someone is no longer lying in a wet bed, unable to call for help? My patients understand the value of neurological scores, but they tell me that what matters most are personal outcomes. How do we measure a husband walking out of a ward holding his wife's hand and going home, or washing the car with a granddaughter, playing a game of golf again, throwing a hardball and hard, or walking up a hill and overtaking people that are older than you? These are not small wins, these are measures of dignity and life itself. So today I ask the Parliamentary Friends of Parkinson's and all the elected representatives here to advocate for the people in the your electorates who will be diagnosed with this disease by recognising specialist Parkinson's nurses as essential workforce, not optional extras, and funding these roles equitably across New South Wales, including regional and rural communities. With the right support, Parkinson's does not have to take dignity, connection or hope. Specialist Parkinson's nurses protect these things every day, quietly and often invisibly. And if it feels like I keep coming back to this request, I sometimes joke that after all these years in Parkinson's care that I might be a little dopamine dysregulated myself. But this isn't punding, it's persistence, because when you see what specialist Parkinson's nurses prevent, preserve and protect, you don't stop asking for what works. Thank you.
Thank you so much, Rachel, for sharing that case study and for putting a face to Parkinson's. Really appreciate it. The other thing in Parliament House, another vagary in Parliament House is sometimes an agenda has to be amended accordingly. I would like to call upon the Minister for Housing, Homelessness, Water, Youth and Mental Health. I remembered all five, Rose Jackson, to say a few words.
Thank you, Mary Kay, and thank you for being a little bit flexible about bumping me up to say a few words now. I have to pop off to a press conference in a few minutes about the coronial inquest into the Bondi Junction tragedy that happened a little while ago. So I really appreciate your flexibility fitting me in now. Look, I just wanted to come along. One of the first things I did when I was elected to Parliament in 2019 was with the then member for Port Macquarie, Leslie Williams, start Parliamentary Friends of Parkinson's Disease. And it's fantastic that Phil Donato and Robert, so ably replacing Leslie in Port Macquarie, and Joe and others have stepped in this term to make sure that this fantastic organisation continues. Like many in the room, I have personal experience with Parkinson's disease. My mum was diagnosed and had very advanced Parkinson's for a number of years before dying with complications of Parkinson's disease. And everything that Rachel said on behalf of the Parkinson's nurses rings so true to me. As the Minister for Mental Health, I know that Parkinson's disease is not just a physical illness and a neurological degenerative physical illness, that the mental health impacts are profound. One of the particular impacts that my mum experienced was a real fear and a distress around medication. She became very, very fearful of taking medication, of being medicated. She also suffered Lewy body dementia alongside her Parkinson's disease. The Parkinson's nurse that helped care for her alongside my dad was absolutely critical in keeping her medicated and stable for those periods that she suffered. And I can never thank the Parkinson's nurse that worked with my family enough, and that's why I'll always show up for Parkinson's New South Wales. Look, we know that there needs to be more funding for the Parkinson's nurses. We know that this is an ongoing project. It's important to recognise that, the government understands that. We've done some work with Parkinson's New South Wales, but there's more to do. And I just wanted to come along on behalf of the government. I should also acknowledge that the Shadow Minister, Sarah Mitchell, is here. So all of the parties are here who care about Parkinson's disease, want to work across the Parliament as people who have lived experience of the impact of this disease on themselves and their families, to say we love you, we value you, we're part of your community as well, and we want to work with you to make sure that we do everything we can to support people living with Parkinson's disease and their families in New South Wales. So thank you.
Once again, Rose, thank you so much for your very kind words. You've all just heard from two of our experienced Parkinson's specialist nurses and viewed that powerful presentation. We thank our Newcastle support group members for their willing participation to be part of that video. So you now have some insight into Parkinson's disease, but I would also urge you to mingle and chat with the diverse community and diverse members of our Parkinson's community in the audience today. You will meet people living with Parkinson's at various stages of the disease, care partners, fundraisers and donors, GPs, neurologists, researchers, allied health practitioners, and Parkinson's New South Wales board members, current and past. And in that latter category, I would like to acknowledge the Honourable John Watkins, AM, and also Mr Andrew Whitten, OAM, previous Parkinson's New South Wales Board Chair, both gentlemen living with Parkinson's. Also in the audience today, we have nurses. We have many Parkinson's specialist nurses from rural and regional areas and also Sydney. We have some of our staff physically present and others tuning in through the live stream. Together they can present the challenges and realities of Parkinson's. It is a progressive, degenerative neurological disease. Its cause has not yet been definitively established, nor has a cure yet been found, although there are treatments which contribute to quality of life. Parkinson's disease is now described as a Parkinson's pandemic. It is the fastest growing neurological disorder globally and a major driver of disability, falls and hospital use. In New South Wales, an estimated 68,850 people are living with Parkinson's. That's a staggering 31% of the national total. For every person living with Parkinson's, at least 2 family members or carers are impacted. That means around 206,550 people in New South Wales live with the daily consequences of Parkinson's. I can assure you that with that number of people, every single electorate in New South Wales is touched. Parkinson's is more common than many cancers combined. And yet attracts far less dedicated system investment. We have a fact sheet available today which spells out the significant system pressures New South Wales faces. These are due to the cost of falls and hospital bed days each month occupied by patients who are clinically ready for discharge but cannot leave hospital. This costs the state around $62 million per month. People living with Parkinson's are at particularly high risk of recurrent falls, unplanned hospitalisation, prolonged length of stay, delayed discharge, and premature entry to residential aged care. In other words, bed blocking. This is a major issue for New South Wales Health in caring for people living with Parkinson's. To put a human face on this issue, let's consider the situation of Mr David Vaness, OAM, a former chair of the Parkinson's New South Wales Board. David and his wife Cheryl, who is with us today, they live in Bathurst. When David's Parkinson's advanced to the point where he could no longer safely be cared for at home, he was admitted to Bathurst Health Service on 19 July last year. He was discharged 19 days later into Catholic Healthcare Macquarie Care for some respite, while a permanent bed was being found. David was there for 49 days before being readmitted to Parkinson's Hospital, where he remains today. That's 133 days in hospital as of now and counting. During this period of hospital stay, Cheryl has been advised on a number of occasions that there are no rooms available in any aged care facility in Bathurst and that David may be transferred to Oberon or Blaney or even Penrith. So David has remained in limbo now for a total of 201 days, pending transfer to a facility potentially far removed from his home and support network. This is the harsh reality of Parkinson's for patients, carers, and for New South Wales Health. However, these negative outcomes are strongly influenced by factors that can be addressed through nurse-led care. The benefits of this approach, as we have heard from Joe and Rachel, include timely clinical advice, medication optimisation, falls prevention, care navigation, and coordinated discharge support. Parkinson's New South Wales has been this state's specialists Parkinson's organisation for 47 years. We deliver the 1800 Parkinson's New South Wales info line, which is a nurse-led statewide virtual clinic, along with a co-funded Parkinson's Specialist Nurse Network, which are embedded in predominantly local health districts, but we are not adverse to supporting nurses outside of this for urgent and critical care needs, as Joe and Rachel can attest. These initiatives are supported by us through complementary counselling, education and peer support programs. Funding, however, is an ongoing challenge for Parkinson's New South Wales. We currently receive a very small level of recurring annual government funding, and as you saw earlier, significantly lower than comparable neurological organisations. The current round of funding of $99,000 over 3 years ceases on the 30th of June this year. Therefore, in our 2027 budget submission, Parkinson's New South Wales is seeking a further 3-year partnership with the New South Wales Government for a total investment of $3.8 million, focused on 2 high-impact integrated services, the 1800 Parkinson's info line, the specialist virtual clinic providing the statewide nurse-led advice, navigation and support, and the Parkinson's Specialist Nurse Network, the hybrid virtual and community-based service that supports people with Parkinson's, carers, GPs, specialists, allied health within the local health districts, with a particular focus on rural and regional New South Wales. Parkinson's New South Wales will more than match this amount from non-government sources, i.e. donations and fundraising, bringing total annual program investment to around $2.5 million. That means Parkinson's will invest $2.5 million annually from donations and fundraising. Specialist nurses are key to this strategy. Parkinson's patients require multidisciplinary care and support. Parkinson's specialist nurses are the glue which holds those multidisciplinary teams together. Using conservative New South Wales cost benchmarks, the Infoline and specialist nurse programs pay for themselves if they achieve very modest reductions in falls and hospital bed days among people living with Parkinson's. From the state government's perspective, the annual investment is fully offset. Their investment is fully offset if the combined Infoline and nurse network prevent around 74 related hospitalisations per year or avoid approximately 1,500 hospital bed days per year. David Vaness has scored 10% of the hospital bed days already. Any additional reductions in falls or bed days represents a net saving for New South Wales Health and frees capacity for other patients. So how can the Parliamentary Friends of Parkinson's and Parkinson's New South Wales work together? By advocating and raising awareness of Parkinson's amongst key decision makers and policy influencers, then helping us to translate that awareness into action, particularly around obtaining funding appropriate to the scale of Parkinson's, the challenge facing us in New South Wales. That funding will go towards growing the Parkinson's Nurse Program, which will permit significant improvements in Parkinson's care for patients, particularly in rural and regional areas. It will also enable the extension of the related nurse-led Infoline service. Together, when appropriately funded, these two programs will address the significant needs and challenges of the Parkinson's community in New South Wales and hopefully avoid a repetition of cases like that of Mr. David Vaness, OAM. We thank you for your interest in our organisation and our cause, and we look forward to partnering with you. Thank you. The run sheet then said that I would then throw to Rose Jackson, but it is my pleasure now to hand over to Dr. Joe McGurr, Co-Chair of the Parliamentary Friends of Parkinson's and Member for Wagga Wagga. Dr. Joe.
Thanks, Mary Kay. Thank you very much. Great. Thanks so much, Mary Kay. And can I begin by thanking all of you for making the effort to come here today. I know many of you have travelled quite a fair distance to come down here. And for many of you, you're probably looking at it thinking what an odd sort of an event this has been and an odd sort of place. But you are, as I say, as Phil said, you're at the oldest parliament and the heart of the decision-making process. And your presence here today has an important influence on MPs and decision makers. So thank you so much for coming. And I do want to acknowledge my parliamentary colleagues who have attended today at different parts because of the nature of business here. People can't get here often for the whole session. But I do want to acknowledge that it's not another division. I know that's starting up. We're right. Thank you. So can I acknowledge David Saliba, member for Fairfield, Eleni Patinos, the member for Miranda, Jeff Provost, the member for Tweed, Trish Doyle, the member for Blue Mountains, Natalie Ward, MLC, Deputy Leader from the Upper House of the Liberals, Steph De Pasqua from Drummoyne, seat of Drummoyne, Steve Barley, who's still here from Blacktown, Tim James from Willoughby, Greg Warren, Campbelltown, Paul Toole, who I noticed up the back still from Bathurst, Sarah Mitchell, the opposition lead for Health and Regional Health, was here as well, and Roy Butler, member for Barwon, I think Roy's just left, Jackie Scrooby, the member for Pittwater, and Helen Dalton, the member for Murray, and that's in addition to, of course, Justin Clancy, the member for Albury, Mike Holland, who's the Parliamentary Secretary for Health, the member for Bega, was here earlier, and of course Phil and Rob and myself. So, and the member for Coogee. So, and the member for Lane Cove. Thank you. I'd be a lousy whip, wouldn't I? I felt like a whip trying to get all the numbers. Thanks, Bob, and thanks, Jackie. The reason I want to thank those colleagues for coming, but the importance of that for me is that you are touching and helping to touch the MPs and raise important awareness about this illness. I remember when I was at medical school, Parkinson's disease was held up as one of the miracles of modern medicine because of the discovery of L-DOPA, and it was the vision that a drug would cure everything. And I think in the public's mind, still today, Parkinson's is underestimated because we think we've got treatments for it. And as you can tell from today, it's far from over. It's an incredibly debilitating illness, tragically. I don't have to tell you that, but it's important that we let people know that message throughout our state, and that's why events like this are important. It's particularly an issue in rural and regional areas, and the role of the nurses is absolutely critical, as you heard today. So much about making people's lives better isn't the medication or the surgery. It's actually providing people with understanding, education, support, pathways. And the older I get, I guess the wiser I get, the more I appreciate how important the work of people like Joe and Rachel is in our communities, and Kate Warren in my community, how important that is. And look, these are the sort of services that are under threat. And so when we met, the Parliamentary Friends of Parkinson's met, and Phil took the lead on that with Rob, we wanted to be a bit strategic this year about what we did. We wanted to be a bit more than just a get-together group. We wanted to have a couple of strategies, and as Mary Kay has outlined, we want to make the retention of those nurses a key issue for the government. And hopefully in the second part of this year, Phil, we're going to have another gathering to push the info line. So, we're not just saying, love Parkinson's, give us more money. We're saying, come on, these are some specific strategies that will work, and let's get focused on it. So that's what today was about. And I just would encourage you, please, to go back and contact your MPs as well and push those clear objectives for us. Can I just, and I also want to acknowledge the importance in rural regions. I had an interesting conversation with Professor Sue earlier today, and who's at the back, and she highlighted for me, and I say this to Helen Dalton, who's got interest in neurological diseases in rural areas, the importance of herbicides that's now being investigated and that impact, particularly in rural and regional areas, in terms of the etiology of Parkinson's disease. So it's a complex picture and there's great research going on, but it does, for me, highlight that issue around rural and regional areas. So look, can I just finish by once again thanking you all. I do want to congratulate the Board of Parkinson's New South Wales and acknowledge John Watkins, but I also do want to particularly thank the team, Mary Kay, you and your team. It was a pleasure. It's been a pleasure working with you, I've got to say. We've had a number of teleconferences to plan this, but your team's been professional on it, got everything organised, and I've got to say, I'm looking forward, I think the three of us are looking forward very much to continuing to work with you, raise awareness of this in the centre of parliamentary decision making, awareness and put pressure on the government to make sure we can achieve those two objectives. So can I get you to put your hands together for Parkinson's New South Wales and for our presenters today? Now, I think it was great having Rose Jackson here, and I think it was great that she made time to come despite all the issues going on at the moment that she has to deal with. So that was great. Phil, I think I've covered everything. Right, I got the thumbs up from Phil. Rob? Yep. Okay. Mary Kay? Always got to check with Mary Kay. I think there's time still to mingle. There's still a little bit of tea, coffee, juice and some sandwiches there, so we might call it a day there. We're resuming Parliament, so we'll be around for a little bit, but we'll mosey on. From the bottom of my heart, from the Parliamentary Friends of Parkinson's, thanks all of you for making the effort to come here. It really sends a message to the MPs come in. They see how important this is. It translates to votes, gets their attention, okay? Thanks so much. Good on you.